Joining me right now, Tracilea Young, the president of something called Tetra Health Care Systems. Now, we are here to talk about medical marijuana. You've been our guest before. The legislation was passed. So, in general, so people understand, what are Tetra Health Centers?
Tetra Health Centers are a medical clinic with a full medical staff and board-certified doctors where people can go to see if they actually qualify to use medical marijuana as an option for treatment.
Now, you have some personal experience with medical marijuana. Tell us about that.
I do. The father of my 8 children was diagnosed with stage 4 throat cancer, and when he started with chemo, it was awful. That's an experience you wouldn't wish on anybody. And with his weight loss and just nausea and vomiting, we decided to try medical marijuana as an option for treatment. And the facilities that we went to were unclean, they were non-HIPAA compliant, they were just nowhere that you'd want to be if you were ill. So I decided to kind of set a very high standard and open up Tetra, which is, they're beautiful facilities, and we treat people with respect and dignity.
And how many are there in the Tampa Bay area?
So we've got 6.
Oh, 6 facilities. Okay, so they're equally spaced out. So let's talk about the legislation that was passed. First of all, this was a long process. Have you been able to look at the legislation and see what it includes?
I have. I actually spent last week in Tallahassee again, and you never know exactly how that's going to go, but I feel like we had some good outcomes. The best part of it, I think, is they've removed the 90-day waiting period, which that was a huge stumbling block for a lot of people.
Now, when you talk about medical marijuana, because then they get into the numbers game, and I only call it a game because it's trying to figure out, well, how many dispensaries do you need versus a number of people that really need this? And I'm always kind of taken aback by the number of people they say could actually use and qualify for using medical marijuana. Give me a ballpark of how many that is. Do we know?
Well, what we do know is that the state of Florida has over 417,000 people who have been diagnosed with a chronic or debilitating condition that they're on daily meds for. So we know that we can start with that number, but I'm sure there are plenty that haven't been diagnosed yet that are suffering from all the condition.
And the reason medical marijuana is being used by a lot of folks is because we've been seeing a lot of stories about opioid abuse, and the fact that with opioids you tend to have to need more and more and more, and then it can get to be a mess. But what is in quotes the magic behind medical marijuana? What is it in marijuana that makes it work?
Well, in our bodies we have an endocannabinoid system, and so what we do is our body, the receptors that are already in us, take hold of this natural product that grows. Our body automatically knows what to do with it, and it utilizes it to help minimize whatever the condition is that you're dealing with.
So it has a numbing effect rather than a stimulating effect?
So there are different parts. So you've got a CBD portion of the marijuana plant that would kind of, it's a downer, maybe, if you will. That would kind of calm you down. It addresses pain. It's very good for you, depending on your condition. Then there's the THC, which is the one that kind of gives you more of that kind of high feeling, but it's also got a very important role as far as treating people with things like cancer or any kind of terminal illness.
The whole thing with medical marijuana gets to be very, very emotional, but it also gets to be into a kind of a legal conundrum, because you have the federal law, which still does not approve marijuana use, and then you have the state and local laws and the medical marijuana laws that are thrown in there, and I always wonder if law enforcement kind of scratches their heads and goes, well, what are we supposed to do now?
Right. Right. It is very confusing, I think, for everybody. Even so I think the state overrules the county for sure, but the federal overrules the state. And even the state of Florida, the Compassionate Use Department, when you're sending money for your state card, you have to send a check or a money order because they can't take any payment online due to it being federally illegal.
Oh, that's what happened. So tell me what the process is if somebody thinks that they could use medical marijuana, it would help them. Walk me through the steps to make it legal for those folks.
So they would make an appointment at Tetra Health Centers. They would bring in their medical records, as well as proof of residency and a valid ID. They would meet with a doctor who would go over all their medical conditions, and if those conditions qualify them, they'll be entered into the registry, and then they will receive an email from the state. They can print out a temporary card and go to a dispensary and receive the medical marijuana that the doctor has recommended.
Now, just before we got on the air, I asked you, well, the state has approved 10 medical conditions, and we wrote them down because we want to get them right here. So tell me what those conditions are.
So we've got cancer, epilepsy, glaucoma, HIV, PTSD, PTSD, amyotrophic sclerosis, MS, Parkinson's, Crohn's, chronic non-malignant pain, and any terminal condition.
Now, we know all those are pretty serious all the way down the
Very,
line.
yes.
So, because, you know, again, here's the notion that the people that are against this, and it's worth pointing out that 70% of the voters did approve this measure, but the people that are against it say, well, you know what, this is just going to be a first step to medical marijuana legalization, because it happened in other states.
Right, right. Well, I think they're referring to recreational, and,
Yeah.
you know, in a sense it is, but that's not my goal, and, you know, I would fight that. I think it's needed, and I think it's a benefit to people who need it medically. So recreational, it's a whole different ball game. I don't smoke, I don't use it recreationally, but I think it has value for many people, and I've experienced it with the father of my children.
All right, so let's talk about how many are on the registry right now, because that's the first thing that you got to do. You got to get your name on the registry.
You do, and right now there are 20, well, it changes obviously every day,
Yeah, right,
but just over 24,000.
What number do we think that will end up being?
Gosh, you know, you've got over 20 million people in the state of Florida, so I don't know.
Yeah, because again, I'm not trying to be negative about this, but I'm trying to
Right.
figure about the argument about control. We know that certain counties, Hillsborough County was one of them, had passed their own regulation.
Sure.
The state law supersedes. It basically says that you can have 25 dispensaries per medical marijuana treatment center. What's a treatment center versus, is yours a treatment center?
We're not a treatment center, we're just a medical clinic, more of a wellness center. So we do the evaluation, you know, we definitely do a wellness exam. So we check all the vitals and make sure that the patient is healthy to begin with, healthy enough to be treated.
And then there was also a big argument about whether you should be allowed to smoke it or not.
Correct. That is a big debate, and I think that the legislature, that's where they're drawing the line. They don't want it to be smoked in order to eliminate the possible intake of recreational use.
Right, that kids could end up somehow getting a hold of it.
Correct.
So from your perspective, do you think that this really fulfills the spirit of Amendment 2 for the use of medical marijuana or not?
No, I think it's a good step forward.
Good step, okay.
And I think that the 90-day elimination is great, and we definitely needed that, but there are so many additional steps that need to be addressed, but we'll have to take those up next session.
All right, one step at a time. Tracilea Young, President of Tetra Health Centers, thank you for talking with us. Appreciate
You're
it.
very welcome. Thank you.